NMIF producer Matt Grubbs, I mentioned earlier, speaks with Workforce Solutions Secretary Bill McCamley about the state's expanded response for workers who have been laid off because of coronavirus.
Secretary McCamley, we know you are busy. We appreciate your time. When the governor announced that she was expanding the unemployment insurance program, she named three kinds of workers who could seek benefits who perhaps weren't previously able to do that. What are those classes or kinds of workers, and is that where you're seeing the bulk of your new claims?
Right. So last Monday, the department issued a new order that will allow people to get on unemployment insurance without having to do what is called a weekly job search. We have waived that requirement. In regular unemployment, you have to be able to show that you've searched for a job during the weeks that you are getting your benefits. Well, the way we're viewing a lot of these hour reductions and layoffs is temporary. And we're hoping that a lot of people can go back to the jobs they had before as soon as this situation kind of starts to go away, right? So what we did was waive those requirements, and we've had a lot of people apply, and we are trying to be as open and flexible as possible for folks that do apply, because we want to help people get through this situation. Governor Lujan Grisham has asked us to use every tool in our toolbox to be able to help people get through this situation. And if we can help people perform social distancing, make sure they're staying away from other folks as much as we can, we're doing everything we can to get folks the money that they can get through unemployment so they can do those things and keep us safe and stop people from dying.
It sounds like we're looking at folks who have been laid off as a result of a business that's lost a lot of its income due to the impact of COVID-19, workers who are self-quarantined or have to be self-quarantined because of a diagnosis, and then just the hour reduction. So if you work 36 hours and you're cut back to 25 or 20 or something like that, those folks are eligible as well?
They are, if they make less than $461 a week. The maximum benefit is that number, $461. And so if you go, for instance, from making $600 a week and you've worked very steadily over the past 18 months and you get cut to $300 a week, you should be able to apply for what we call partial benefits and get the remainder, which would be about $161. And in terms of the question you first asked, where are we seeing the most folks that are applying? It's where you would think. It's the service industry. So folks working previously at hotels or convention centers or restaurants, bars, malls, folks like that have been asked to not come to work to make sure we keep our social distancing as well as we can. They're the ones that are mostly applying. Though we are seeing some new applications from the oil and gas industry as the global situation has really affected oil prices, and those have started to come down.
Okay. You don't have to be a full-time employee, is that right?
You have to have worked 4 out of the last 5 quarters and hit certain income levels for those quarters. We do ask people that apply to try to have at least their last 4 pay stubs available if they have them. That makes life a lot easier on the folks we have that are processing the claims.
And we're going to get contact information for you all up on our website, NewMexicoInFocus.org. I would imagine you're trying to push people as you internally make the transition to working from home. You're trying to push people to the website as much as possible.
Absolutely. So our website is jobs.state.nm.us. Once again, that is jobs.state.nm.us. We are very, very proud of all of our staff here at Workforce Solutions, but specifically our internet technology staff, who have kept our website working very strongly throughout this whole situation. You've seen other states around the country where their websites have just simply crashed. That has not happened here. You can go online and do your initial claim and your weekly certifications online. So we're encouraging everyone to do that if they can. About 95% of our initial claims so far have come in online, and we're thinking that's a much better situation than people having to call into our call center, which has been extremely busy these past couple weeks. So if you can go online, it's better for you because it's more convenient. You can put in a routing number for your bank so you can get a direct deposit and get your benefits faster. And if you can go online, you're going to free up call space for someone who's calling in who can't go online. And we do have some folks around the state that have to call in. So going online, if you can and have the resources to do so, is just better for everybody.
Okay. You mentioned that you've eliminated the work search requirement, and that extends for 4 weeks. As you've had now roughly a week and a half to kind of settle in to what's happening with COVID-19, does that feel like it's going to be long enough for you?
We're not making that assertion right now. We're going to try to get through the next couple of weeks. And when we hit that end of that 4 weeks, I believe the date is April 10th, we'll start looking at it at the end of that week and make a decision then. But right now, we're just trying to really help as many people as we can, get as much money as we can out the door if they apply and are eligible for our system.
Just from a policy standpoint, is the thinking, the governor's thinking and your thinking, that the economy right now simply doesn't have enough jobs to sort of enforce that you must search for a job provision, that it would just sort of be, jumping through hoops?
Yeah, and look, this situation, Matt, is completely unprecedented. No one's ever seen anything like it, either here in the state or nationally, in terms of the amount of people that are filing in the short amount of time. You didn't even see anything come close to that during the Great Recession. And so our thought process is we're basically putting everything on hold as much as we can for the next few weeks so we can get through this situation and keep people alive and keep our healthcare system from being overwhelmed. I think as frustrating as this situation is, that's what we've really got to remember here. It's not only the effects of the virus itself, as we're seeing in other places around the country, are very serious. But if our hospitals and clinics get overrun, all sorts of what we would normally consider regular industries, regular healthcare issues aren't going to be taken care of. As an example, I was talking with some construction folks yesterday, and they were saying, hey, we want to get back to work and we want to do what we've normally done. And I said, fellas, I understand where you're coming from, but here's the situation. If we don't socially distance, if we don't perform these strategies that all the public health people in the country are asking us to do, and you fall down and break a rib, on your job, you're going to go into a hospital and not be able to get into a bed because people could possibly be overflowing with COVID-19 situations. So it's not just the direct virus response, so that is extremely serious. It's also the secondary effects. We're trying not to overload our healthcare system. If we can be patient, if we can be kind to one another and realize that everyone here in New Mexico is pretty much related to everybody else. We're one big family. I like to joke there's only about 6 degrees of separation in the whole state. But if we act like we're at our best Thanksgiving dinner all the time, and if we can remember that we're all in this together, this is a team game. Every single one of us has a job to do, and we can be patient and kind and team players. We're going to get through this together.
I know you're not unsympathetic to those folks who feel like they have to go to work to get a check. Having talked with you enough in the past, I know that's something that resonates with you. But how do you convince people to stay home if they are sick?
Well, just look at what's happening in other parts of the world. You look at what's happening in Italy. You look at what's happening in New York. You look at what's happening in some of the other places around the United States where just as of the last few days, we're seeing large spikes in places like Louisiana. This is better for everybody. And we know that it's hard. We know that it is frustrating. And we know that this is not what normally people do. And it's not just the work situation, though you're right, that is a massive factor in how people kind of respond to this. But it's also just we're social creatures. We like doing things together. We like going to the bar. We like going to movies. We like hanging out with our friends and family. But if we don't practice these techniques that all the public health folks are telling us to make sure we keep 6 feet, 7 feet away from people, that we wash our hands constantly. If we don't do that, we're not going to flatten the curve, which is something I bet most of your viewers have seen, and we're going to see a worse situation. If we can make those adjustments to our day-to-day lives, and that's part of our job in the government, is to get as much money out to people as possible to help them through these next few weeks. But if we can do that, we are going to flatten the curve. We are going to see not as great of a effect on our society, and we're going to be able to get back to normal sooner rather than later with as minimal health effects as we can. If we don't do those things, if we ignore the advice of all our public health people, more people are going to get sick. Unfortunately, more folks are probably going to pass away. We're going to see our healthcare industry overloaded. And we're not going to get back to normal as quickly as possible. So that's really the advice of where our governor's coming from. Governor Lujan Grisham has been very strong in her message that we are prepared. We are all doing what we need to do. We're not panicking. And if we can get through this here in New Mexico, we're all going to treat each other like family and get through this together.
Secretary McCamley, thanks so much for your time. We appreciate it.